Here we go, Dr.
So we will
Lori
start.
and her hand project.
Ready? My hand project.
Do you want a pencil? No, I'm just kidding.
Oh, yeah, there we
And then
go.
we have the, she always emphasizes on
I know.
the gluteus maximus.
Here, you can use the pencil without the lead, right?
There we go.
There you go.
And then we have the gluteus medius. There is a gluteus minimus underneath. Actually, let's take off the gluteus maximus so we can show the minimus,
So
even though you
on
don't
the-
need to know it for the practical.
Okay, good.
But just know
Might
that there
need
is
to know
there-
for the test, is what you're saying?
Yes, might need to know. Yes. So then we'll move down to the hamstrings. And so starting laterally, so lateral would be our baby toe. We have the biceps femoris. So remember, the biceps femoris is on the back. The rectus femoris is anterior on the front. Oh, this one's kind of nice because it's got some extra paint to see the difference between the two muscles. So the semitendinosus is here on top. I can't read that number, but maybe you guys can.
Number 16.
16, okay, I'll take your word for it. Semitendinosus. The semimembranosus is deeper underneath, so you'll see it here and here.
Okay.
So the semimembranosus is beneath the semitendinosus. Then just rotating around. Now this would be a medial view. You can see the pubic symphysis and the coccyx, so that tells you you're medial. It's a sagittal section. We have the gracilis, so that's the medial muscle. There are also some adductor muscles in here that you don't need to know. So we'll do the
What
thigh,
about the,
and then we'll move down.
What about the flexor, the femoralis, or the biceps femoris?
Biceps femoris, so that was this
was
guy
that? I'm sorry.
right here.
I'm sorry.
That's okay.
Okay. I thought,
Gracilis, and then rotating, we're going to see the sartorius, our talar sit muscle, right here, straps around. Then we'll do the
can you do that
quadriceps.
talaris one more time?
Sure, sartorius.
Sartorius. Okay.
Talar
or the
sit
talar
muscle.
Okay, gotcha.
Then our quadriceps, so we have 4 quadriceps. So our rectus femoris is here in the middle, flanked by our vastus medialis and our vastus lateralis.
Okay.
The 4th quadricep is beneath the rectus femoris, so that's going to be the vastus intermedius. Beneath.
Vastus
Okay,
intermedius.
I won't take it apart because actually I'm going to use the art for that. Oh, nicely enough, here it is right here, the
So in the
vastus
test, that's kind of what you're going to do is the art.
intermedius. Yes, so you can
It's the one
see
that's
that.
mostly tendon.
Yes, so they've stripped away the rectus femoris so that you can see the vastus intermedius beneath the rectus femoris.
Okay.
So for orienting yourself, again, you know, the pubic symphysis, you're going to know that's medial, and so then the vastus medialis should be medially located. Then the vastus lateralis should be lateral. This little short muscle here that inserts on the iliotibial band is the tensor fascia elati.
Wow, just that little one?
Just this little tiny one has the longest name for such a short muscle. And so that completes the thigh. Let's go down to the lower leg. And let's start with the tibialis anterior. So here's our tibia, and then the tibialis anterior. Then we have our extensor digitorum longus. Notice how that extends to the tendons of the digits, the lower digits. Now we're in the lateral view, so that's the perineal compartment. So we have the fibularis longus, this long muscle here that runs in line with the fibula, and then the brevis is this smaller muscle here. So longus and brevis.
The brevis, that's not on the...
The brevis is not on the list, so you just need to know the longus. Then to the very back of the lower leg, we have the 2 bellies of the gastrocnemius. And then at the side, we have the soleus. So the soleus is the muscle beneath the gastrocnemius. And so you can see it from either view, soleus, gastrocnemius. And then we're back around to the tibialis anterior, tibialis anterior, TA. Patella.
Toes.
Toes.
All right.
Calcaneus.
Cool, thank you.